Welcome to Ideagen TV live here at the NASDAQ in Manhattan. We could not be more thrilled, and I say this with incredible admiration for the work that you're doing. Mr. Rawle Andrews Jr., Executive Director of the American Psychiatric Association Foundation. Welcome.
Thank you, George. Appreciate you having me.
Well, you know, Rawle, what you're doing right now to change the world is profound. You're working on the most impactful campaign in recent history. And that, I don't want to take away your thunder, but I've got it memorized. mentalhealthcareworks.org. Encourage everyone who's watching this program to take a look at that site, mentalhealthcareworks.org. I'd like to ask you, what is it? Why is it so important?
Everybody has mental health. And I think we didn't really appreciate that everybody has mental health until we endured COVID-19 pandemic and found ourselves trying to survive in a different kind of way than we had ever grown up to do. And so as we've emerged from the pandemic, what we have seen is we didn't go in the same way we're coming out. And people are being more vocal about what's happening to them and people they love and people they work with, people they go to school with, and so forth. And so Mental Health Care Works is designed to turn this moment, this season of heightened mental health awareness into a movement to change lives and to save lives.
To change lives and to save lives. It's profound. And so what does the American Psychiatric Association Foundation do? What is your key mission?
So the American Psychiatric Association Foundation is a 501c3 charity. We are the research, education, and charitable arm of the American Psychiatric Association, which is the largest body of physician psychiatrists in the world. And so what we're out doing is talking not just to clinicians, we're talking to the patient and the caregiver community so that they can better get connected to the mental health care they need.
Yeah. And so all over the news, globally, in any country, in any place in the world, you are seeing and hearing about mental health, right? It's an issue, especially post-pandemic. And even during the pandemic, you started to see it. You saw the light on inequality and inequity. You saw the light on inequity and inequality within education, within healthcare, within jobs, you name it, right? I mean, the light is shining and beaming down, and it all starts as part of this whole mental health component. So the awareness has gained significant attention. We understand that. How does the foundation contribute to reducing barriers to de-stigmatizing, to mainstreaming mental health like anything else? Oh, I have diabetes or whatever it may be. How do you do that?
So our mandate is to help people better understand through awareness and literacy that there is no health without mental health, that your body is going to feel what your mind tells it to. And in order to kind of break down stigma, we have at APA and the foundation outlawed the term. In Mental Health Care Works campaign, we don't talk about stigma at all, because when we go across focus groups and ask people to tell us what is stigma and where did it come from, nobody can do it. So how do we unpack stigma so that it can be actionable and we can turn some difficult conversations into some courageous conversations? So what our campaign is drilling down on, instead of being stuck on stigma, and I want us to not be stuck on stigma anymore. What we want to talk about is fear. Because if you have a fear around your mental health condition, we can work with you on that. If you have shame or embarrassment about your mental health condition, we can help you with that. But the one thing that gets a movement going across the centuries and the ethnicities is when you say somebody's being discriminated against, is being marginalized because they have a mental health condition. Now everybody's willing to sign a pledge. They're willing to take a petition. They're willing to go out on the streets or on the internet and say, never again, enough is enough. So that's kind of what Mental Health Care Works is doing. We're starting with this awareness and helping to build some literacy so people have a better understanding of what's happening. And then we go to the next step, which is behavior. When you go to the pediatrician because your child needs a physical, let's talk about the whole child, not just about knees or hips or elbows. When you go to a gynecologist, whole and well, let's talk about everything that's going on. You're with a family practitioner, then we got to do whatever we need to do. But more importantly than anything else, if you're not connected at all, at least in the United States, we now have the new 988 crisis helpline. So we're also using this campaign to help the federal government promote this new crisis helpline 24/7, 365. You or anybody you know can talk to a counselor today, right now, about whatever's going on with you. And if you do need help, they can either help you right now or they could get you on the continuum to get some help.
And that's incredible. And you note something that I think is a sort of follow-up question to that, which is the innovation. How do you begin to stay on top of the innovation, all of the areas? I hear so many organizations talking about mental health. How do you stay on top of what's really going to change the game?
So one of the things that we have done, other than to constantly be in a learning modality, is we have a board and work groups across the various domains, because we're attacking mental health and well-being where we live, learn, work, worship, and play. And our board is configured with doctors and non-doctors around live, learn, work, worship, and play. And then we have a corporate advisory council. And this is 23 leading organizations, most of them Fortune 500, but not all, including, for example, Johnson & Johnson is represented. And so what we're able to do is not only have our doctors talking to us about what they're seeing, not only with patients, but in academic settings, but then you talk to industry in real time about what their patient experience is. And if you notice with diabetes, for example, is treatable, who's having more fun in the world than somebody who has type 2 diabetes? You never hear anybody with diabetes talking about stigma. You never hear anybody with hypertension, high blood pressure, talking about stigma. You never hear anybody talking about PTSD outside the military community and stigma, right? All of those conditions, depression, diabetes, both treatable, anxiety, PTSD, both treatable, high blood pressure or heart disease, and eating disorders, all treatable conditions. People didn't know that. So it's taken us about 2,500 years to get to this season. So we don't expect people overnight to stop saying stigma. We don't expect them to stop overnight and go and do something about it. But we want them to know what the tools, the tips, and the resources are. That's right. So that when you're ready, or when somebody who loves you is ready to nudge you into the journey, that you'll know where to start.
It's amazing, 2,500 years. I mean, that's a long time. And it's a shame, but it's inspiring to hear that you're tackling it. And there's really no other organization better suited to addressing and changing the game and changing the world here than the APAF and the APA.
So I believe we are suited. There may be other organizations who are equally suited. But again, if you had heart disease, you would be talking to a cardiologist representative, not a psychiatric representative, right? So whatever your condition is, you go see a professional. Right. Your car breaks down and you don't know how to fix it, you take it to a mechanic.
Right.
So if you have a mental health condition, you have to be okay to say, let's go find out what's happening. I just can't get over my sadness. Sadness is not a psychological condition.
Yeah.
But it might be something that's driving that could be treated.
And so advocacy. We're both based in Washington, D.C. We see Congress, we see the Senate, we see the White House. Regardless of who's there and what party affiliation, government rolls on. And that advocacy is critical to continue, no matter who's there. How do you lead that? How do you impact that? How do you change the game when you're dealing with so many different entities to make sure that you can change the world and take away any element of call it what you want around mental health?
So our APA Division of Government Relations leads the majority of our advocacy efforts when it comes to what's happening on the Hill. and across states. So I'm pleased to inform your audience today that the Senate in the United States just formed a bipartisan mental health caucus. First time it's ever been done.
First time.
First time. And then on Wednesday of this week, we had our representatives from across the United States in white lab jackets on the Hill, all wearing green Mental Health Care Works buttons. And one of the things that is above the line on the Mental Health Care Works campaign, when something is working, we want to shine a bright light on it. But more importantly, George, when it's not working, we want to shine an even brighter light. Mm-hmm. So what we have to do is keep focusing on parity so that we prioritize our mental health the same ways we're prioritizing our physical health. That includes reimbursing doctors for the same amount, whether it's a physical or a mental ailment. That includes pushing more resources to states and counties so they have what they need when people do call 988. They're going to get the help they need in real time from somebody who's trained to serve. That includes our world-renowned, preeminent resident trainee program. Our fellowship program is nearly 50 years old now. I'm always breaking news on Ideagen. So we're going to have about 250 resident trainees across North America who are in our professional development cohort. But here's what we're going to do to change the game. I am asking my board, and I believe they will accept the challenge, that there are some resident trainees who didn't get accepted into our fellowship program. So we're going to open the Treasury and provide some professional development opportunities across North America for all residency trainees who are involved with APA. And you're going to have travel stipends, book scholarships.
Wow.
We might even be looking at some loan repayment type options because we know our medical doctors come out with enormous debt from both college and medical school. But then the last thing, I was introduced recently to HOSA. This is an organization of high school and college students and alums that are involved in health professions across the gamut. And I had a great meeting. They've invited me to be on their International Advisory Council, and we're in advanced stage discussions right now about a national MOU where the APA Foundation and HOSA would get together and be in all their schools with our Notice Talk Act framework as a signature initiative of both organizations. That would change the game not only for educators, both in college and in K-12, but it's going to change the game for those students because now they're going to get introduced.
That's right.
To tenured psychiatrists, to mid-career psychiatrists, to early career psychiatrists, to residents and some med students who were once where they were. And figure out how we got on our journey. So I'm looking forward to hearing more and learning more about the great work HOSA has been doing since 1976. But I can assure you the next time we come here, we're going to be sitting here together with you talking about the great work HOSA and APA Foundation are doing together.
Rawle, that's the type of thing that we're talking. This is the Global Partnership Summit. And so when you're talking about connecting the dots and connecting, for example, the APAF with HOSA Future Health Professionals and that pipeline of 270,000 plus students and 3 million plus students since 1976, you've got a massive opportunity collectively. And that's collective impact. That's what we refer to as collective impact, which drives me now to volunteers. So volunteers are at the heart and soul of the APAF and the APA. Why are they so important? And how do you begin to get these people motivated from across communities all over the country to get involved in what you're doing?
So our force multiplier, our competitive advantage, is that we have over 38,000 physician psychiatrists across 100 countries in the world. We can't be everywhere. So when you have a tragedy in Greece, like we've recently seen, we're getting intel directly on the ground from doctors in Greece. Maui got intel directly from doctors in Hawaii. So one of the things they're able to do is make sure that everything we do in the foundation is medically led and patient informed. Now, that's something that a lot of other organizations couldn't do because you might have a medical officer, and many do, but you don't have 38,000 doctors across all the specialties and subspecialties of psychiatry. And one of the things we're really proud of, that our international president today, Dr. Petros Livonis, I think you know the sound of that name, just happens to be Greek. He has made the theme of our year for his presidency, recovery and addiction. So every month we're talking about how to help people with substance use disorders find out that it's treatable, and then get on the road to recovery.
You know, incredible to hear again how you're connecting the dots and how you're leading the way. And Rawle, that's the key, is setting the tone. We've had thousands of interviews since the inception of Ideagen TV and Ideagen Global. And the resounding similarity in those interviews has always been leadership, setting the tone, changing the game. And you're disrupting the status quo. The status quo has been, you don't talk about it. Now you've launched mentalhealthcareworks.org. So make it like diabetes. Make it like any other malady that you deal with on a daily basis. I have a headache, I'm not feeling well, whatever. Deal with your mental health issue so that it's solvable, it's treatable, like you said.
And I'm going to tell you how ready we are as a collective, and particularly our younger generations. In the first month and a half of our campaign, we had 24.5 million engagements with our assets. In the first month and a half, on World Mental Health Day, which was October 10th of this year, I did a satellite radio tour across 55 markets with 260 airings, 1.5 million impressions from one day of interviews.
There you go.
So people want this information,
but
what we want them to do is do something once they get it.
Right.
When I knew what I knew, I did. But now that I know better, I need to do better, because I don't want to have to live in a world, and none of us should have to live in a world where we're thinking about, how do I make sure my tomorrow is better than my yesterday so that I can be whole and well, and those around me can be whole and well. And what I love about APA, and why I'm going to put a smile on your face, the international president and the speaker of the General Assembly of APA, Dr. Vasilis Pozios. Do I have to say it? I'm surrounded by the Greeks. Look, and I'm learning something new that I need every day because of it.
Well, I won't say it, but I have to. I will say it. It all started with the Greeks. So, it
took me 2,500 years to figure it out. But now that I've figured it out, I'm not leaving them. I mean, as a matter of fact, they were disappointed they couldn't be here with us this year. We are going to have a representative from the New York area who is a Greek American who's going to join us tonight. But the reality of it is, we're all in this together.
Yeah, that's right.
Right? It is
that's
humanity.
Right. That's right.
And if we don't work on this together, then we are going to be stuck in the status quo. And the status quo is not good enough. And maybe it never was.
Yeah.
But now we know it's not.
Yeah.
So we got to do better.
Right. Rawle, as executive director, what message would you like to convey to the public? What message would you like to convey to the public about what we've talked about today, about the importance of mental health? What is that key message? You've talked about it. Encapsulate it for our global audience, the millions of people that will watch this interview on Ideagen TV. What is that message?
There is no health without mental health. And if you need help right now, or somebody close to you needs help right now, and they're in the United States, I want them to dial 988 or text 988, and let's get you some help. If you're not ready to do that, it's fine. Don't beat yourself up about it. But when you're on whatever device you love, go to mentalhealthcareworks.org and just play around and see what you find out, because ultimately we have to make sure we can get through today and ensure that our tomorrows are always better than our yesterdays.
I mean, what else can you say? Rawle Andrews Jr., Executive Director, American Psychiatric Association Foundation. You are changing the world, my friend. You're leading the way, and you're changing the world. Thank you so very much.
Thank you, George.
Thank you.
We're going to do it together.
mentalhealthcareworks.org. Check it out. Thank you.